My name is Ellen Godfrey, and I am a retired teacher, but working part-time teaching reading and enjoying that very, very much. I want to live to be 100. And so I just really feel the best thing to do is to be engaged in some special thing, and I think teaching really fulfills that role very well. I would say my biggest health concern is definitely blood pressure, because I worry about all the consequences, like stroke, heart problems, all those kinds of things. And they do scare me. I love open notes for the fact that I can just keep track of everything that's been going on in my health. I want to be a partner. I want to really be on board with my health. I don't want to be in the dark. I don't want to have the doctors have access to things that I don't. I want to know. Open Notes gives me the opportunity to sit back and review what I heard at the doctor's office and to digest it. Even if I call and speak to a nurse, she writes an open note about that. If I forget what was said about the medication, I can go back and see what medication and what the dosage is, and all the things that I'm supposed to know are all recorded in that note.
So I'll update that in the computer.
All right, yes.
And what else?
And the hydrochlorothiazide and metoprolol.
Ellen has been one of those patients who, when Open Notes started, she definitely joined in. And I think that it added a lot to our relationship first, and then to her health. All right, so let's measure your blood pressure.
With her, I just feel that, she revealed to me through the open notes that all the little communications that she puts in there, all the things that she says, that she heard me say, she puts it all down, and it makes it very easy to trust her.
Okay, that sounds good. And I'm going to have you take a few deep breaths.
All right.
Go ahead. Knowing that I was electronically, like a key away, or however you want to think about it, I was just right there. I think that gave her more confidence to manage her hypertension. How about any symptoms when you're doing exercise?
The open notes will reveal that, she talked to me about the diet and the food and what an important part exercise has in lowering blood pressure. So it's so wonderful to be able to go back and review what she said. And it just kind of gives you a little shot in the arm to say, I'm, slipping a little bit here, but this is what she said, let me get back on track.
Because I do think it will affect your blood pressure.
Yes.
I think it allowed her to take control over her illness, which is something that is empowering, and it's very important for patients who have chronic disease to feel like they understand what's going on and they know how to slow it down and sort of manage it. So I think in Ellen's case, it was a perfect fit. The more knowledge and tools that she had, the better her condition seemed to be.
I do feel like a healthier person with my open notes. It's about me, and I want to know what's going on with me, and that's the most important thing.